Hi, my name is Samantha Simonetti and I'm a student physical therapist here at Campbell University, and today I will be talking about the strain counter-strain technique. I will first talk about the science behind strain counter-strain, and then I will move on to talk about the treatment specifically for the medial epicondyle of the humerus. So strain counter-strain was first brought about by Lawrence Jones, the developer of the technique. He believes that aberrant afferent flow of a muscle spindle creates muscle spasm in an area of a group of muscles, creating a fixated joint. This fixated joint can't move back to its neutral position. He found that the diagnosis of these muscle spindles firing in an aberrant way was through palpating a specific tender point of the area. He has a whole series of tender points throughout the body, but today I'll be talking specifically about the medial epicondyle tender point and how to treat it. So the medial epicondyle tender point is located 5 centimeters above the skeleton, 5 centimeters above the medial epicondyle of the humerus. So I've got it located here with this black tape. And when treating this tender point, you actually treat it the same way you treat the tender point for the 4th posterior thoracic rib, which I have located here with indicated with black tape. So as I treat it, I'll show you with our patient positioning and the use of this palpated point as well as this palpated point. First, I'll start with the step-by-step motion of the technique. So I'll have Phil come over here real quick. So for this technique, you are actually going to start with the patient in a seated position. You're going to have them so that their lower extremities are actually away from the area that is the tender point. So in this case, we're actually going to have the tender point be on his left side. So we'll have his lower extremities going to the right side. If your patient is not flexible enough to have them actually move their legs up onto the treatment table, you can use a stool or anything lower, but just make sure that the legs are facing away from the tender point. So in this case, Phil, I'm going to have you bring your legs up onto this surface here of the stool. Okay, good. And to locate the tender point, once again, we're going to go to the medial epicondyle, and then we're going to go about 5 centimeters above it. At that point, the patient should have some slight pain and tenderness, and that's how you're going to locate that tender point. Then, to treat this tender point, you're going to have the examiner stand behind the patient. You're going to bring your leg up onto the treatment table. Have a pillow or a surface for the patient to lean on. You're going to bring that elbow up onto that surface and make sure at this time that you're still palpating that tender point. You're also going to locate that 4th rib by palpating at C7 and down to T3 and over to that 4th rib. By having their arm up, you're actually moving the scapula out of the way and you're able to palpate that superior surface of that 4th rib. So I've located it there. Now I'm going to make sure that the patient is in a position of relaxation. The first thing I would do in that case is I want to bring their arm, their opposite arm, passively behind them. I'm going to have them relax and move into this position. Have them come towards the examiner and away from, or actually leaning into the tender point. Then I'm going to have the patient rotate away from the tender point. At this point, I'm going to have this position, I'm going to hold this position for 90 seconds. While I'm holding this position, I'm going to explain a little bit more about the principles of this technique. When treating any tender point, you should treat the proximal tender point first. You should treat the most active tender point first, and if there is a line of tender points, typically you should treat the middle tender point first. The highest accumulation of tender points, whether they are on the back or the anterior part of the body, make sure you treat those first as well. If you have a patient that is not capable of telling you that they are in pain, this is a technique that should not be used. It's contraindicated for anyone that's not capable of telling you that they're in pain. So we're going to hold that point, like I was saying, for that 90 seconds. When that 90 seconds is up, you're going to bring them back to position. You want to make sure that you're doing all of the effort. Don't allow them to go back into position, because then that can recreate the muscle that was spasmed before. You want to make sure that that doesn't happen. Come out in the front here. I'm going to bring these legs back into a neutral position. And then you want to ask the patient, has the tenderness gone away?
Yes.
Okay, very good. So at that point, you want to make sure that the tenderness, if you give them a scale, they should be at about 70% better than they previously were. So now I'm going to give you a little bit of an explanation as to what you can say to your patient when talking about this technique. So Phil, strain counter strain is a technique used to slow down and eliminate the firing of a muscle that might be a little overexcited. Okay? So similar to a Christmas tree and a strand of lights, one string of lights, if one light goes out, typically that whole string of lights goes out, right?
Mm-hmm.
So in this case, if one muscle group is not firing correctly, that whole muscle group will go out and it won't be efficient, okay? So what we're going to do is just turn that out completely, okay?
Okay.
So the next thing I'm going to do is first show you how to perform this technique one more time, and then talk to you a little bit about the science, or the scientific findings. So we want to make sure our patient is in a seated position. We're going to get their lower extremities onto the opposite side. Good. You want the examiner behind the patient. Palpate the tender points. Have the patient lean into you. Passively move that opposite limb to the back. Rotate slightly away. And hold it there for the 90 seconds. So the scientific findings I found were in a Lewis and Flynn article specific about low back pain with patients. They found that the patient's pain scores on the Oswestry and McGill questionnaire actually went down after 2 to 3 treatments of strain counter strain. Passively move the patient back. In neutral position. And how are you feeling?
Feel good.
Good, fantastic. And that will be all for today.
Yeah. Good job, Sam.
I can't remember.